Hi, I am Aurel Enriquez, and this video contains one of our special topics in microbiology where we talk about things that we don't usually discuss during our regular classes. But for today, let's find out what is long COVID. Here is the outline of our discussion. For those who already forgot, let's just have a quick review on coronaviruses. Next, let's have a simplified discussion on the pathogenesis of COVID 19. And finally, let's answer the question, what is long COVID? Let's proceed with our quick review on coronaviruses. Within the family Coronaviridae, we have four different genera, but let's just focus on these two, the alpha coronaviruses and beta coronaviruses. Under the genus alpha coronavirus, there are two species that typically infects humans, and then under the genus beta coronavirus, there are four species that could infect humans plus others that typically infect mammals. They are enveloped, helical, single stranded RNA viruses surrounded by glycoprotein spikes that appear to be like club shaped projections, as we can see right here in this 3D rendering. So, the first ever scientists that were able to observe this virus under an electron microscope thought that the spiky appearance somewhat resembled a crown, hence the name coronavirus from the Latin word corona, which means crown. Take note of its receptor to the host cells. So, on the surface of our alveolar cells, that's where we could find the ACE2 receptors or the angiotensin converting enzyme 2 receptors, where on these ACE2 receptors, this is where the glycoprotein spikes of the coronavirus listed here are the clinically significant species of coronaviruses. SARS-CoV was the causative agent of the severe acute respiratory syndrome epidemic way back in 2003. Next is the MERS-CoV, which causes the Middle East respiratory syndrome, which emerged in Saudi Arabia during 2012 and also again became a public health concern around the earlier parts of 2019. And of course, we have the SARS CoV 2, the causative agent of the COVID 19 pandemic, which we all know and have experienced from 2020 to 2023. This one belongs to the genus Beta coronavirus, and according to an article that was published by the World Organization for Animal Health, and I quote, current evidence suggests that SARS CoV 2 emerged from an animal source. Genetic sequence and data revealed that the closest known relatives of SARS CoV 2 are coronaviruses circulating in the Rhinolophus bat population. Rhinolophus bat population, otherwise known as the horseshoe bat populations. Now, according to our current reference textbook for Microbiology 1 and 2, the most common coronavirus infections started as a coronavirus that jumped from its normal animal host onto a susceptible human. Let's now have a very simplified discussion on the pathogenesis of COVID 19. Amongst the general population, the infection can spread from person to person, direct or close contact, and inhalation of contaminated particles. For some people, infections could be mild or even asymptomatic, which is why there are people out there who doesn't show symptoms but would test positive for COVID-19. And even when they don't show symptoms, they could still definitely spread the infection to others. For people who do show symptoms, they develop pneumonia. This is brought about by the destruction of the cells within the patient's lungs, leading to the usual symptoms that we know, such as difficulty breathing, fluid buildup on the lungs, and inflammation of the lungs. Infections also lead to a cytokine storm. So, according to one article published by um, the health segment of the Dot Dash Meredith Publishing Company, normally cytokines are meant to be helpful to us in moderation, but when a certain pathway is engaged too much, the immune system starts causing damage to the patient. This means that an excessive number of cytokines are released, which create high levels of inflammation in the area of the body being targeted. So much inflammation that it starts to do more harm than good, right? So that's what we mean when we say cytokine storm or hyper inflammation. Let's just quickly go through the infectious cycle of SARS CoV 2. The following images are publicly available from an article published by Time, as in the Time magazine USA. So, first, the virus needs to use its glycoprotein spikes to bind to the correct host cells, which in this case would be the ACE2 receptors. Next, the virus gains entry into the cell by fusing its envelope with the cell membrane and uncoating or releasing its RNA strand. After that, the ribosomes within the host cells would read this genetic material, and as this viral mRNA strand passes through the ribosome now creates viral proteins. Now, these viral proteins are needed to make copies of the viral RNA as well as other parts of the virus, like the outer spikes and membrane. And as more proteins and RNA strands are made, they proliferate, making exponentially more copies that fill up the host cell. Next is the assembly stage, wherein the virus would now make use of mechanisms of the host cell for these viral proteins to come together, forming a new and complete virus particle, as we can see right here in this GIF. So, when they're fully assembled, the virus can now exit the host cell and move to other healthy cells and repeat this cycle. And of course, for these new virus particles to exit the host cell, listed here are some of the high risk conditions for COVID 19. This would include diabetes, obesity, history of smoking, and of course, cancer, heart disease, and kidney diseases. So, these high risk conditions are what we more commonly know as comorbidities, right? So, these comorbidities could contribute to the severity of the infection. Listed here are other affected organs. So, of course, we know that the primary organ system that is targeted by this virus is our respiratory system. So, it targets the cells of our respiratory tract, our lungs. But as we can see right here, it's not only the lungs that becomes affected when we acquire the virus. So, the virus could also attack the cells of our heart, intestine, pancreas, and kidneys. All right, so keep that in mind. It's not just our respiratory system that could be affected by COVID 19, but also a few other of our organ systems. Next, we already know this. The method of diagnosis for COVID-19 is through RT-PCR, or the real-time polymerase chain reaction, and the currently available vaccines that we have is the mRNA vaccine. So let's now answer the question, what is long COVID? Let's proceed to look at some of the formal definitions of long COVID. According to the World Health Organization, or WHO, the post COVID 19 condition, commonly known as long COVID, can affect anyone that has been previously exposed to SARS-CoV-2, regardless of age or severity of original symptoms. It is defined as the continuation or development of new symptoms 3 months after the initial SARS CoV 2 infection, with these symptoms lasting for at least 2 months with no other explanation. While common symptoms of long COVID can include fatigue, shortness of breath, and cognitive dysfunction, there are over 200 other different symptoms that have been reported that can have an impact on everyday functioning. There are people out there literally living with the aftermath of their past COVID infection even after they've recovered from their initial exposure. According to CDC, or the Centers for Disease Control and Prevention, listed here are the signs and symptoms of long COVID. Long COVID can include a wide range of ongoing symptoms and conditions that can last for weeks, months, or even years. Some people may experience health problems from different types and combinations of symptoms that require comprehensive care, and long COVID symptoms and conditions could actually result in disability. This info is still from the same article by the CDC, and I've inserted a citation right here. The most commonly reported symptoms of long COVID include fatigue, brain fog, and post exertional malaise. Now, when we say brain fog, this is characterized by confusion, forgetfulness, and lack of focus and mental clarity. Meanwhile, post exertional malaise, or PEM, is a delayed worsening of symptoms that occurs after minimal physical or mental activity. The main characteristic of PEM is that the malaise, or extreme fatigue and flu like symptoms, which are not in proportion to the amount of activity that has been done. To simplify that statement, it would feel like you're way more tired in comparison to the little amount of physical activity that you just did. But wait, there's more. If we scroll through the same article, we would see that there are so much more, like respiratory symptoms, neurological symptoms, digestive symptoms, and even many more that are hard to explain and difficult to manage with no lab tests to determine them. So it seems like there's a lot more that we don't know about long COVID compared to what we do know, or what research has currently provided us. Research shows that adults are more likely than children to get long COVID. Long COVID symptoms and conditions can negatively affect an adult person's ability to perform many of their normal daily activities and can cause physical, emotional, and financial stress. People have experienced a reduction in their ability to work full time, plus increased healthcare costs to manage most of the symptoms that we've seen on the previous slide. Aside from that, the unknown and long term nature of long COVID can further worsen the stress. Imagine trying to live your everyday life, but from time to time, you feel your mental capabilities are no longer as sharp as they used to be, or your physical stamina constantly declining. As we've seen in the previous slides, long COVID is different for everyone, and people experiencing long COVID may need different activities, treatments, or strategies that could help them. So, obviously, we won't be able to actually go into a deep dive into all of those symptoms listed previously. This discussion only serves to one, have a simplified or easily digestible conversation about long COVID, and two, to raise awareness that these post COVID conditions actually exist and is seriously affecting some people. Here are the references that were used in the making of this presentation. That ends our simplified discussion on what is long COVID. This has been Aurel Enriquez. Thank you so much for watching.